Great. So it's with pleasure that I announce or present or welcome Bonney Lynch. And Bonnie, welcome to our call. Tell us a little bit about some of the activities you've got going on at the lifelong Ashby Health Center. And I created some slides from the notes you sent me, and I also have a slide of your website. And I was not able to put this on a slide, so I'll put this up to start with in case you just want to say something about that before we go over to the slides.
Okay, so this is a slide of our externship site here at a community health clinic in Berkeley. We're an FQHC and a level 3 patient-centered medical home. And I started at this site as a clinical supervisor for the American College for Traditional Chinese Medicine in May of 2010. And a few years back started also treating patients directly. And this slide has a Tibetan couple that we were treating in the same room because of translation issues, and the student working with the female patient in the foreground is doing tongue diagnosis, and then I'm in the center, and then the student in the back is treating the husband who had some rotator cuff issues. So we did a sideline position, and they're actually pretty straightforward, those particular patients, so they didn't have a behavioral health component, but we did interact with their NP, who's their primary care provider, about the physical therapy that both patients were receiving. And in general, the students do have access to Nextgen EHR is what we're using, and we do have an acupuncture template that we're refining. I haven't made a transition to documenting everything that we do on EHR, so that's one thing I would love to get more input on. And in addition to that, under my main questions, just to cut to the chase, I know this has already happened in Oregon and some other parts of the country, but in the spring we are shifting at Lifelong to the alternative payment model, which means that we will get our federal funds for Medi-Cal patients based on patient outcomes. So I'm looking at how to capture those patient outcomes within the Nextgen system, and also how to figure out how to refine what we're doing, both in terms of the services we provide and how we work together to provide those services so that we can optimize our outcomes. So that's it in a nutshell, kind of what we're doing. I'd be happy to answer any other questions, or maybe other people have things to say about that transition into the APM issue.
Thank you, Bonnie. So if people have more questions,
you're welcome.
I kind of encouraged Bonnie yesterday when we spoke to kind of rush through. She has a lot to say. She's doing a lot of different things, and to kind of rush through the beginning to get to her main questions. But if you have any questions about what she's doing or how it works, or questions that would help you give input to her questions, please do ask.
And Beth, you can also prompt me because we talked for some time, so if there's something that you feel is pertinent that you want me to speak to, that might be helpful also.
Yes, well, one of our participants today said he was looking forward to hearing you speak because he had some questions about acupuncture in a hospital setting. So we can even start there and then move to thoughts about these main questions.
Sure, and I have the list of who I think is in the group in front of me. So
good.
So I'm a little bit oriented as to who people are.
Oh, great. Good.
Yeah, hi, this is Steve Sina, and I have a question. I'm not familiar with Nextgen. Is that just a electronic medical record system?
Yeah, it is.
Okay.
It's not, it appears to not be one of the favored ones, but it's what we have.
And it's also a pretty common one.
Yeah, we're in several versions of it. There's several generations down, but as a supervisor, one of the tricky parts of this in terms of getting more documentation on that is that I have to, supervise all the patients and the students, and then actually do the inputting myself, or at least review it and sign off on it. So I only do it for certain select cases because I don't want to get in deeper than I can manage. And I'm transitioning as a program to getting an MA and admin support, but for the last 2 years I've actually been functioning entirely on student volunteers. All the volunteering, all the MA, everything that I do. So I'm kind of behind on the DHR part of it, but when we do our notes, we try to write them like we're writing them to the other providers who don't get the opportunity of, multiple weekly visits with their patients. So we try to put in their social background and what we have an idea of what their individual goals are and things like that. So I think it's a really useful tool. It's just a little bit cumbersome at the moment.
Hi, Bonnie. This is Jennifer Oliovnik. It's nice to be reacquainted with you.
Yeah. Hi.
Hi. A few things come to mind, and we maybe want to speak offline, but I have been doing some work, as you know, with integrative patient-centered medical homes around the country, and I can put you in touch with another acupuncturist working at ACIH Health Institute in Gaithersburg, Maryland. I'm not sure if you're already familiar with them or not, but they are, I'm not sure which EHR, they're in their second type of EHR. They had a problem with the first one. They might be able to troubleshoot and kind of brainstorm some ideas about what they're doing with patient outcome data collection.
Yeah, that would be really helpful. So I will email you separately about that. But there's some things that are kind of built in to the program, but there's many things that aren't. But I have an opportunity right now because I'm redoing our template. So the easier we can make that, the better. And when I get my my admin support, what I want to do with the students that continue to volunteer is develop a scribe position. Because the people that I know that have effectively really captured patient outcomes have an MA or someone else that functions as a medical scribe. And that's all, that's their entire job. And Jeffrey Geller, I know, does that.
Hi. This is Martin from OCOM.
Hi.
So I had maybe more of a comment that maybe, this is something that we could all sort of ponder and, if we want weigh in on. But, as we, place, our students in these integrative settings, whether it's hospitals or, integrative clinics, public health clinics, whatever, and as, our profession is looking towards, has already started the development of first professional doctorates with, intercollaborative, care competencies and whatnot. I mean, one of the questions I have is that, and maybe a bit of a concern is the reality is most of our students upon graduation are still going to be sole proprietors. So while these experiences are absolutely crucial, I think, to their improving their knowledge and for a variety of reasons, the question I'm keep coming back to is, how do we make those types of experiences for the majority of our students who are going to be sole proprietors applicable in that sole proprietor context? I mean, I guess I'm trying to.
Well, let me tell you, it took me a long time to get to the point where I am now in a position to get a benefited 20-hour position, and I basically created the program and my position. But from my vantage point, I'm thinking that the combination of the change in funding for Medicare or Medi-Cal patients and the issues around reducing opiates are really a possibility for work for acupuncturists in this kind of setting, because you're going to be looking at patient outcomes. So then the issue is, you know, going back to that same thing of trying to figure out how to work within these systems and capture the outcomes that will make sense to the people who are making decisions in the programs, which are usually physicians. So one of the things I said to Beth, and I just am posing this to the group, is you don't have any physicians on your work group, and she did say that you've discussed this, so I'm sure, you know, there's been many thoughts about this, but that conversation just needs to keep happening. But I do think that there will be more opportunities, and the other thing I'll just insert, because sometimes our discrete professions that fall within the integrative umbrella, maybe we also function independently, sometimes politically. So like the other main place that you would be able to get an actual benefited job is through the VA, and we still don't have that occupational job code. I don't know why that fell apart in 2013, but my understanding is that we get to apply as acupuncturists for that again in 2018, and I'm really hoping that there's a way, maybe other people have thoughts about this, about how to get enough momentum so that that becomes a reality, because I'm afraid personally that the acupuncture training and programs and profession as on a deeper level of understanding and knowledge is going to disappear. There's just not enough options for work for people. It's not sustainable. I have students that are borrowing over $100,000, and they get out and they have very complicated choices to make. That's my big picture answer to that.
Hi, this is Martin calling. I'm sorry. It logged me out. So.
Did you hear what I said, or?
No, I'm sorry. It just cut out, and it took me a minute to realize, like, oh, I'm offline.
Okay, so is everyone else there?
Yes, we're here. So sorry about that, Martin. I wonder what happened.
Okay. Well, Martin, if we want to revisit that, I could just say briefly what I could repeat briefly what I said, but I think with the a transition to the alternative payment method, which is, you know, going to take time, but it's my understanding that's already happening in Oregon, and programs are looking at solutions for both reducing opiates and better patient outcomes, that there's going to be opportunities for acupuncturists there. But that one of the crucial pieces that has to come into play is better data collection for patient outcomes, and that's part of why I posed that as part of my question. And then the second thing is that I'm hoping that all professions can do things like collaborate on getting an occupational code for acupuncturists so that they have choices like to work within the VA system, which my understanding that next application would be in 2018. Did you get that?
Yeah, I did.
Okay. So, you know, you can only speak from your particular vantage point, and having created a benefited position, which, you know, I'm certainly not being overpaid, and had to really stick it out for quite a while to create that, but I can see that being in this position, once the patient outcome funding changes, there is definitely room for other people like us. It's just going to take a little while. And the students that come here that are pre-med that work with me also are getting to a different introduction to how integrative medicine might work than I think sometimes they get within the integrative medicine programs, training programs that physicians get. It's a little different vantage point. So that the more that we're in settings where we're working with lots of different providers and they're exposed to what we actually do and how we can work together, I think is also going to have a big impact over time.
Mm-hmm.
Yeah, I don't know if I want to bring this up, but go ahead.
Go ahead. Jump in.
No, I know that. I know that. You know, I practice a lot of orthopedic acupuncture, and this dry needle movement has been something that has been at the forefront of my list. And
is this
what
Stephen?
we're seeing, yes, it is. Sorry,
Hi.
it's Steve. Yeah, and we're seeing other healthcare professions, you know, doing needling in these medical settings. You know, what is the role of acupuncture moving forward? How do we describe what we do? How do we, you know, is it the role of the institutions, the educational institutions, or is it something that we're hoping that a national group, not necessarily AAAOM, but, you know, another guild or something can take the reins on? I guess I don't have the answer. I guess I'm just posing it as a...
Well, you know, Stephen, I am curious about what you think about that, but I'm really concerned that, you know, there's, if I understand it correctly, the enrollment in acupuncture programs in California is flat, and it's likely that some of the schools are not going to make it. So I would think that
nationwide. It's not just California.
Right. So
nationwide.
It's a big concern to me because a lot of the professors that I studied with were physicians in China, and I felt like I got a really good training. And I'm concerned that the training that's going to be available moving forward, or 5 years from now, is going to be a lot more diluted because there's just not enough jobs to warrant the cost. So I'm just curious, why is it that our profession is not more representative? Chiropractors have an occupational code, if I understand it correctly, for the VA, but we don't. And I don't think that the professional doctorate is enough. I think that's helpful, but, you know, right where I sit, I have a master's, and I'm thinking about whether I want to do that, and I'm not really sure it's worth the money. I might consider a master's in public health or something else, because a doctorate means that here in California that I might be able to get hired at Kaiser, even though I've been licensed since 2012. They're hiring new grads with doctorates instead. Or I could work at a school where I'm not going to get benefits. There's not enough work. There's not enough positions.
You know, I think in the interest of time, I'd like to direct this all really, really good discussion,
Sure.
Very important. I'd like to direct it back to one of your main questions, which is transitioning to the alternative payment model. Does anybody have any thoughts on that, either that you've been thinking about or questions you have, or anything that we want to discuss on that point?
Maybe Jennifer has something to say, because I bet she knows more of the clinics that are actually doing that. I know the Manuel Garcia Clinic in Portland is operating with that funding system now. Isn't that right, Jennifer?
I'm not so well versed in that one per se, but the one that comes to mind is the one where Regina Dehan, is it CNN? I'm getting all of them mixed up, but that school has level 3 PCMH status as well, and I think that has been somewhat fresh. I think it's under 3 years that they've been at PCMH. And they could tell you about that transition from migrating into that kind of environment.
We've been in that role, that designation, for about a little over a year right now, and
okay.
We're getting funding partially from the Washington County, and I think you are referencing Virginia Garcia is county health clinic. When Washington County Public Health closed their doors, they put out an RFP, and both NCNM and Virginia Garcia were recipients of grant money that allows us to care for uninsured and uninsurable patient demographics, and that's a very predominantly Hispanic population. So certainly that shifted who our patients are at NCNM, particularly in our Beaverton clinic. The PCPCH status at the main clinic, I don't know that that's been anything tremendous as far as the shift that it's created. We were already starting to see more and more Medicaid patients, and that's, I think, certainly helped us to continue to build with that momentum.
And who is this that's talking now?
Melanie.
I'm sure.
Henrik.
Melanie. Oh, I see you. So were you able to expand some of your integrative medicine services as part of this, or do you have any special
I don't know what
about?
And two, we've already, all of the partnerships that we've been building on are things that were already in place. For instance, Pacific University, we have an interprofessional shift with their psychology students. We run 3 shifts a week at the psychology school out at Pacific University, both at their downtown and at their Hillsborough location, and then they have some psych students come over and hang out on our clinic shift. That was already in work before the primary care status officially came into play. I think really the vaccines for children, that shift happened more because of the Multnomah County, not so much because of our Tier 3 status. The natural clinic in and of itself, I think that because we've always had so many therapeutic modalities at our fingertips, those have already been incorporated in. We have care teams now with our Chinese medicine counterparts within the clinic. There was already a collaboration there. So I think because of the primary care status, we perhaps delineated those care teams out a little bit more. But as far as what the patient really sees and what the clinicians are seeing, I don't know that it's changed much.
So I'm talking about funding, not PC, not patient-centered medical home, but alternative payment model.
The funding aspect,
or method.
Yes. So the funding aspect has shifted some through Medicaid, and because of that status, we're eligible for more funding through the Oregon Medicaid program, the Oregon Health Plan. So the patients that we see, we have a higher reimbursement rate for.
So has that yet made a difference in what, the increase in funding just made it able for you to better do what you're already doing, basically, rather than expand?
Perhaps some. I think it's helped to fill our clinic shifts to where our students are seeing more patients, and certainly they're seeing more diverse patients because those patients are covered more completely underneath the Oregon Health Care Plan. But no, at this point in time, it hasn't really allowed for us to expand what we're doing. Much.
And has your patient data collection changed, or what are you doing about that part to have the funding?
We are part of the EPIC system through the Ocean Collaborative and Ocean. So that has been a continual involvement for about the last 3 to 4 years. At this point in time, I would say universally we are not collecting as much data as we would like. Part of it is just getting all the docs and the students to click the right boxes in EPIC as opposed to just typing the information in there. So I would say in the last year we have much more robust data collection. We are not yet at a spot where we feel like we are anywhere near where we want to be for data collection.
Yeah. I think that's what I hear from most people.
Well, this might be a good time to transition. Bonnie, you're welcome to stay on the call, and thank you so much for sharing some of the things that you're doing and some of the questions you have. I think this discussion was useful for everybody, and I hope it was useful for you as well.
Sure. I really appreciate being able to participate.